Welcome back. I'm Deepak Shrivastava. Today I'm going to talk about the COVID infection and when you are caring someone at home who are infected. This is a very important review of the current guidelines that came out of the CDC and are universally applied, at least in the United States. In the cartoon on this slide, you can see the subject, which is the infected person, is sitting here while the family members are around them as well as their pets are in there. And we will talk about that, how we are going to secure this home environment with the person who is isolated or in home isolation or even in shelter in place. So let's look at this slide here. Those who are infected, not everybody needs to be hospitalized, as we understand that about 80% of these infections are mild and self-limited illness. Of course, there is no treatment available at this time. So they are asked to go back home, which is a very difficult situation for the rest of the family member, patient themselves, worrying about how the cross-infection will happen and other people can get infected. The timeline here at the bottom of the slide, you can see the infection probably occurred sometime back here in the time and continued until the incubation period started. The time where the infection occurred to the appearance of the first symptom is called the incubation period, which is, in case of COVID-19, is considered to be a little over 5 days, 5.1 days to be precise. So on day 5, the symptoms begin to appear, and we understand the symptoms are cough and fever and shortness of breath, perhaps. Now, lately, as of yesterday, the new symptom is added, which is diarrhea. And 62% of the patients who are suffering with mild disease can actually present with gastrointestinal symptom, mainly diarrhea. And at this point, if the person is either isolated, so day 1, all the way to current standard quarantine, or the isolation is considered 2 weeks, which is 14 days, you can see that they are at risk and they are continuously shedding the virus throughout this period. And we really don't know when somebody will clear. Towards the end of this discussion, we'll look at that when somebody is cleared of their infection. But this is the period from day 5 all the way to about 12 or 13 days is the critical period when the person is actually ill. And if they do not have any other complications, they should begin to recover around this time. So the important part is when to seek the medical attention when they are home. And pardon me for putting a distracting picture here at the right corner of the slide, but I wanted to emphasize that how important it is to recognize some of these signs and symptoms, because there may not be a healthcare provider or medical person in the household, and the family members have to make that decision. So if your dear ones who is in isolation and has mild disease, or in isolation because they were asymptomatic and now they are becoming symptomatic, these are the symptoms to look for in addition to cough and fever. Troubled breathing, so they're reporting a shortness of breath, persistent pain or pressure in the chest. So pressure is very important. Pain is obvious, but just the complaint of pressure should be taken seriously. New confusion, or they are sleepy and unable to wake up, or bluish lips. In this cartoon here, I have put these bluish lips, and not necessarily everybody will show the blueness to this degree. It may be subtle, so something has to be recognized. Now, having said that, the blue lips, it will be unusual to find them as an isolated finding. There will be other findings associated with it, i.e. the shortness of breath or the chest pressure. The important thing for the care provider at home is to have the provider's contact information, the physicians or the hospital's contact information handy so that you can make that call. Also, if you end up activating the emergency medical system, i.e. calling in the ambulance by calling 911 in the United States, you must notify the dispatch personnel that they are coming to attend on a suspected or a diagnosed patient who has COVID. When you have them at home, most of the time, stay assured that nothing will happen if they are a normal host. That means they don't have many other conditions that we have discussed, i.e. they do not have any cardiac problems, any lung problems, they are not immune suppressed because they are receiving chemotherapy, etc. So Those people will continue to stay in isolation and do well when they are still at home. But we still have to prevent the spread of the germs because they are carrying the germs and they are at risk for giving it to the other family members. Also, make sure that they are well hydrated. Many of these people will lose their appetite and will not feel like eating or drinking. Whatever fluids they like to drink, they should be allowed to drink. And rest is the key. Of course, in the isolation, there is not much to do. Over-the-counter medications can be used for symptoms, for example, Tylenol for fever, if they are not having any problems with the Tylenol previously. And for most people with the mild disease, even these symptoms will last, as we saw in the first timeline, for a few days, which is about 7 days or 10 days. In a few people, we cannot identify them ahead of time. This can last for a little longer time than a week without the complications. With the complication, bets are off and disease can linger a little longer when you definitely need to seek assistance of a medical provider. In this beautiful cartoons here, which I have borrowed with permission from USA Today and is approved by the CDC, if possible, then the subject or the patient should have their own separate room and the doors should be closed. Their bathroom should be designated and attached to the room so that they don't use the common bathroom. In case that's not the situation in the household and there is only one bathroom, after the patient uses the bathroom, it should be all the surfaces that the person has used should be disinfected. Please note that there is data available for the COVID virus to stay on the surface and last on the surface for many hours. And it ranges depending on what the surface is from as long as 3 hours to 8 hours. And this data is changing, so we should keep an eye on the latest information. Having said that, with the routine cleaners and the antiseptics, this virus is very fragile and can be cleared off those surfaces. The airflow is extremely important, or air conditioning in the house, whatever the case may be, and it should be well ventilated. Social distancing is really important. And in this cartoon, you can see here's the patient sitting there, other family member, they both are wearing masks. So if you are in the open space with the patient, both parties have to wear the mask. Having said that, we'll talk about it, what happens when person has to eat. Even you have to maintain that distance with the pets or other animals in the house. As I said earlier, keep the door closed so that the same air in this room, which is confined, does not circulate through the rest of the house. The communication does not have to be necessarily face-to-face and as close proximity. Person can use the texting or the cell phone or FaceTime and utilize the electronic media in order to communicate. Here's the social distancing while everybody is in home isolation. And social distancing, of course, as you hear in the news and you are told every day that it is considered at this time is the single best measure so far to prevent the spread of the COVID virus. Serving food, you can see in this cartoon here, the food can be left outside on a designated table and surface, which will be cleaned after the patient has taken the tray inside and finished eating and left. It should be disposed of as a contaminated object. The waste should be disposed in a designated waste basket and should be cleared properly without any touching or any exposure to the inside contents. Interaction with the pets is important. They are lovely. We like to have them. They relieve your stress during the time of crisis. At the same time, you have to maintain a distance with the pets and not hold them, pet them, kiss them, because your hands can put the virus on their fur and they can be transmitted to the rest of the members in the family. Please know that the dogs, cats, other pets have not known to get infected by the humans. There are a few short case reports, at least a couple of dogs got infected in Hong Kong, but that's all we know of at this point. So when to end the home isolation? If you are going to have a test that will determine that you are free of the infection, in that case, the patient does not have to have a fever. They should be without fever for 72 hours without any medications like Tylenol that reduce the fever. Their symptoms should be improved or gone, which is cough, shortness of breath, fever, and 7 days have passed since their symptoms first appeared. In the case, if there is going to be a testing for them to document that they are no longer contagious, in that case, these three conditions have to be met. No longer have a fever without the medication that reduce the fever like Tylenol. Symptoms must improve. So no cough, no fever, no shortness of breath. And then 2 negative tests in a row, which are 24 hours apart. As we know, the availability of the test kits is very difficult and there is a shortage. They are being sent to the areas where they are much needed and appropriately so. So this option of 2 negative tests may not be available to you. When CDC made this recommendation, the assumption is that we will have enough tests to go around and we will be able to follow this guideline. And at that time, your doctor would know and will order those tests. But at this time, I think that this will be the information that we have to carry, that we are not going to have a test at the end of our isolation period or our shelter-in-place period or home isolation. There's no fever, no cough, no shortness of breath, and 7 days have passed since the appearance of the first symptoms. I hope you find this webinar informative and you can use it. This information is adopted from the CDC, Center for Disease Control, and the USA Today. Thank you so much. Have a nice day.